Hello, I'm Catherine Bruce, and welcome to Acuity Brand's Bright Ideas on Industrial Sage. We're starting with a story of rapid innovation. Joining me is Kurt Vogel, one of our directors of product development. At the start of the COVID pandemic, many businesses had to shut down, but lighting was designated as an essential business. Acuity Brands saw a need in the country's medical response, and it all started with a phone call and was up and running in just 2 short weeks. Kurt, can you tell us about what happened?
Thank you, Catherine. Yeah, it originally started with the news stories that started coming out of New York City that showed the hospitals filling up and the beginnings of temporary hospitals being set up in Central Park. So we knew that there was going to be demand in those hospitals for effective lighting, whether it's a tent or whether it's a converted convention center.
Right.
The lighting in those spaces is not ideal for examining patients and for providing effective diagnosis. So we very rapidly, a small group of people started talking about what can we do, how can we fix this? And over the course of a weekend, the size of the team grew. We pulled in lighting specialists, we pulled in mechanical folks, we brought the electronics folks, as well as our manufacturing and logistics, and started coming up with a design that would allow a single modular solution to be very rapidly deployed that would give the medical professionals the lighting they needed in these spaces, whether a tent or whether a converted convention center space, to give rapid, effective diagnosis of the patients.
And can you tell me a little bit more about the importance of lighting in a doctor's examination of a patient?
Yeah, it's critical, and to the point that the Department of Defense has very clear specifications on what is required for a patient in a mobile hospital. So it was essential that we meet those specifications and, if possible, exceed those. So that was a major part of it. The first, obviously, is the level of light, getting the appropriate amount of light for them to make a good diagnosis. But equally important is the quality of light, the color, the consistency, and the ability for a doctor or for a nurse to very rapidly look at a patient and assess their general condition based upon coloration, based upon, flushing or whatever. Right. So the lighting is absolutely critical.
So how did you all pull it off?
Well, that phone call turned into several phone calls, as you could imagine, over the course of a weekend. And we very rapidly put together a team of folks, both on the lighting side, on the mechanical side, on the controls side, and the electrical and electronic side. We worked with our manufacturing operations and gradually expanded the team to rapidly work with the officials in New York that were on site and knew what the needs were, along with the Department of Defense to assess what their needs were in terms of logistics, in terms of packaging, and in terms of how we could rapidly get this into the facilities in a format that could be easily deployed and used.
Right. Well, how has it been received now that it's been out there for, I guess, about a month now?
Very well. It's been very successful. We call it the PHLS, for Portable Healthcare Lighting Stand. And it does several things that make it very easy to deal with. It can be wheeled into a facility and assembled in a matter of minutes, I think as quickly as 3 minutes. Everything is modular, so it plugs in, it puts the light fixture the proper distance over the bed, and beyond just examination lighting, it also provides the patient with a level of control, because if they are in these places for an average of 10 days to 2 weeks, which we were seeing early on, it gives them the capability of adjusting the light to their personal needs. They can turn it off to sleep, they can turn it on to a low level to read. So it's just a great, very flexible solution. And as you said, we went from phone call to the first shipment and installation in under 2 weeks.
That is extremely rapid innovation if I've ever heard of it before. Yeah. Kurt, what was it like for you personally to work on this project?
Well, it's been very exciting. We were pleased that lighting was deemed an essential business because we know the impact that lighting has as enabling all of these functions, whether it's medical examination or just general patient care. So it was important to us to be able to respond quickly and to do so in a manner that just emphasized our capabilities to help out in this arena.
Well, thank you, Kurt, for giving us a behind-the-scenes look at how Acuity Brands responded during the COVID pandemic. Thank you.